Antidiabetics, metformin, and inhaled insulins. Which non-injectable is right for you? Just diagnosed with type 2 diabetes, or are you type 1 or type 2 but tired of needles and pumps? Meet Max and learn why he chose metformin.
Once came back, they're an 8, so you do have type 2 diabetes, and we will have to treat it.
Okay.
Yeah.
Will I have to do shots?
No, Max. Don't worry about that. We have metformin. It's a pill you take twice a day. We're going to give you 500 milligrams because you are active and you do eat healthy. But if for some reason that stops and we do need to do the insulin, then we will go on with that.
Okay.
So I'll write you your metformin and give that to the pharmacist, and he'll get you situated.
Awesome. Thank you, doctor.
Yeah.
I'm managing my type 2 diabetes by maintaining a healthy lifestyle, so I don't have to take a shot. According to the American Diabetes Association, metformin, sometimes sold under the trade name glucophage, is the first-line drug for managing type 2 diabetes. Metformin, a biguanide, is a class of oral anti-hyperglycemic agents that works by limiting glucose production by the liver and glucose absorption. Also, metformin increases the sensitivity of the body's cells to insulin. Life-threatening side effects include lactic acidosis. Other most common side effects include diarrhea, nausea, loss of appetite, and bloating. Nursing considerations are: use cautiously with patients that have a history of kidney problems. Instruct your patients to take metformin with foods to prevent upset stomach. Temporarily stop metformin in patients requiring surgery. Your patient may not take metformin 48 hours before or after IV contrast. Some common educational topics include taking metformin consistently at the same time every day. If a dose is missed, do not double dose. Metformin does not cure diabetes, but helps manage the signs and symptoms. When combined with exercise and diet, metformin has been shown to have the greatest impact at managing type 2 diabetes. If a patient is experiencing any signs and symptoms, including diarrhea, chills, dizziness, decreased blood pressure, muscle and abdominal pain, weakness, slowed heart rate, or difficulty breathing, alert your doctor immediately because there is a chance you could be experiencing a life-threatening condition called lactic acidosis. Additionally, it's good to let your patients know metformin typically costs without insurance anywhere between $20 to $65 for 100 tablets. Thanks to metformin, I don't have to take the shots.
But what if insulin is a necessary part of your diabetes management? Are injections your only option? Meet Edna and hear her story. Learn how inhaled insulin may be the right choice for you.
Hi, I'm a busy mom, wife, and business owner, and I have type 1 diabetes. This means that my pancreas can't create its own insulin. Insulin is a necessary hormone my body cells need to pull in sugar and utilize it as energy. It's been really hard to manage my type 1 diabetes lately because with pumps and needles, I have to prep and then I have to find a place to inject. And even more so lately, it's been hard to manage because it seems like food pops up everywhere.
Time for a tasty treat!
Edna came to see me because she was having problems managing her type 1 diabetes. Pumps and needles were not fitting her current busy lifestyle. Since her eating habits were spontaneous and on the go, we decided on a rapid-acting pre-meal inhaled insulin, which is the only non-injectable insulin available. This form of insulin would be effective, convenient, and ready when she was. They would also give her a break from injections. Inhaled insulin, currently sold under the trade name Afrezia, is an anti-diabetic used to improve glycemic control in patients with type 1 or 2 diabetes. It involves inhaling a powdered form of human insulin into the lungs, which enters the bloodstream immediately and begins to take effect in as little as 12 minutes. Once in the bloodstream, it stimulates the body's cells to bind and uptake glucose, lowering the blood glucose levels. It also inhibits the liver from producing more glucose. According to statistical clinical research published by the FDA, aphasia significantly lowered postprandial glucose levels, providing proven mealtime glycemic control. Dosing comes in 4, 6, and 12-unit cartridges, and on average, aphasia costs between $15 to $400 a month, depending on dosage and needs and insurance. Life-threatening side effects can include allergic reactions to drug ingredients, hypoglycemia, bronchospasms, and seizures. Other side effects include headache, high blood pressure, fatigue, throat irritation, and cough. In clinical studies, reported coughs were mild and typically declined after 2 weeks of use. Nursing considerations are: inhaled insulins are contraindicated and should not be used by people who have chronic lung diseases, as life-threatening bronchospasms may occur. Therefore, patients should be evaluated and pulmonary function tests should be performed prior to prescribing inhaled insulin and periodically during use. Monitor patients for signs and symptoms of hypoglycemia. In the effect of such an occurrence, follow your facility's protocol for glucose replacement therapy and adjust insulin levels as necessary. Arrange for your patients to receive routine A1C testing to evaluate effectiveness of treatment. Know that if your patient becomes acutely ill, that this will affect their insulin needs. Monitor their blood glucose closely. Inhaled insulin should not be used to treat diabetic ketoacidosis. Patient education is ongoing and involves recognizing and treating hypoglycemia, as this is one of the most common side effects of all insulin replacement therapies. Teach your patients to monitor their blood glucose frequently and carry hard candies or glucose tabs, and to seek medical attention in the event they do become hypoglycemic. Patients should follow drug manufacturer instructions on how to use inhalers. Inhalers should be replaced every 15 days and cannot be cleaned with water. Use a dry cloth. Teach your patients to not pry open, crush, or chew cartridges and to store them in the refrigerator when not in use. Advise patients to perform routine thermometer testing to ensure lung function and to report any signs of symptoms of respiratory difficulties.
Now that I have a rapid inhaled insulin, I can be ready for food at any time.